thank you so much for battling through the Zoom technology. This is a two-part presentation, and I'm going to share my screen just for a very short period of time here. I made a very short presentation to introduce everybody, including our guests. So this is a two-part series sponsored by Southern Tier Lyme Support and Binghamton University. And this session is going to be with Dr. Stephen Phillips and Dana Parrish. We're going to talk about their new book, Chronic. And we also have a special guest. I didn't realize he was going to join us. I'm so excited he's here. Our guest for next week, Dr. Robert Bransfield, and he's also interviewed in the book. So this is just one big happy Lyme family. I'd also like to thank our sponsors, IGeneX and Lifestream Nutritionals. And again, a reminder, next week, 7 p.m., I will do my darndest to get us started actually on time next week. So I apologize for that. I'll take the blame completely. You can send hate mail to mckayrippey@gmail.com. So next week, same time, Thursday evening, we'll be talking with Robert Bransfield in depth about Lyme disease and the brain. And my goodness, if Lyme gets to your brain, you all know what happens there. But this week, we're going to focus on a fantastic new book. I was teasing Dana. I said I was happy to buy this book. I recommend you buy a couple copies of it, one to keep on your shelf and one to give to friends, neighbors, people across the country, your doctor, etc. So let's introduce our two guests here. With over 2 decades of experience successfully treating patients with zoonotic infection, it's a fancy word for bugs, right? Dr. Phillips has been a powerful influencer in the medical community, lecturing that inflammatory and rheumatic conditions can be caused by infections such as Bartonella, Lyme disease, Babesia, and what he calls Lyme Plus. He is currently spearheading a drug development effort to bring public an effective and durable treatment for this infection. And that is super exciting. To this end, Dr. Phillips was honored with the 2018 Emerging Leader Award by the Bay Area Lyme Foundation and sits on their scientific advisory board. And his partner in this project, Dana Parrish, is a chart topping Sony and ATV writer and New York City based science journalist who writes a popular HuffPost column on tick-borne diseases, which is read by over 1 million people all over the world. Dana has become a leading public face of Lyme and other tick-borne diseases and sits on the advisory board of the Bay Area Lyme Foundation. I'm sensing a trend here. And she has been recognized by them for their Courage Award in 2017. Dana and Dr. Phillips were also honored by Harvard's the Dean Center for Tick-Borne Illness in 2019 as People Who Inspire. So their book, as you can see, is called Chronic. Let me switch my screen again here so I can see. Okay. You have to talk through Zoom, otherwise it doesn't work. It's voice activated. The subtitle is The Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again, which is really, it's the key, isn't it? And their mission is to find the key to getting off the medical merry-go-round. Now, before I open the floor to them, I want to say if you want to ask questions, the place to do that is the Q&A bubble at the bottom there. The chat is for to talk to each other. If you want to make comments and just cheer things or boo things, whatever you want to do, use the chat. If you want to have a question queued up for later, I'll try to get to as many as I can. No promises, but do that in the Q&A bubble down below. So Dr. Phillips, Dana, thank you for being here. It's so exciting to speak with you. This book is something. I wasn't quite sure what to expect when I began it. I've read quite a few over the years, but this one is something special. So
Oh,
congratulations.
thank you.
Oh, thank you so much. That's so nice of you.
So one of the things that I really liked about your approach, Dr. Phillips, to Lyme is you talked about early on a fair shake and then an expiration date for a
Right.
treatment.
Yes.
And that is one thing I talk to my patients about is, and it's a real tough one, when to stop.
Yeah,
When
yeah,
when have you gone far enough? When is it time to change horses? Because you don't want to change horses in this middle of the stream, but you don't want to ride that horse till it's
right.
Dead.
yes.
Yeah.
Thank you.
Yeah, no, it's a not something we taught in med school. You know, when I was having Herxham reactions from medications, the doctors I went to would say, "Congratulations, this is great. Keep going." A month later, "This is amazing news. I'm so happy for you." 3 months in, "I'm no better." "Yes, keep going." And then, 4 months into it, I had to put my foot down with various treatments because I was, look, I'm not going to bat my head against the wall anymore. This stuff is not working. So what do you call that? I think it speaks to a misunderstanding at the very, very lowest kind of base level of understanding of what a Herxheimer is. And really, Herxheimer is a combination of two things: a bit of blebbing in some cases that are treatment resistant, where these bacteria shed particles off the surface, and it looks like the intact bacteria. And the immune system can't tell the difference between size, just constituents. So if one bacteria sheds a lot of dandruff or decoys, whatever analogy you want to use, the immune system spends a lot of time and energy going after those decoys, and bacteria is just sitting pretty, not being destroyed, and it really doesn't move the patient forward, and certainly didn't move me forward. So, treatments vary on how long the expiration date is. There are some treatments that take an unfortunately long period of time, like Bicillin, but give or take, it's like 4 to 8 weeks for most treatments, I would think.
So just to reiterate, we're 8 weeks into a treatment and things aren't getting better or things are continuing to look like a herx. You're
Mhm.
saying it's time to begin the conversation about should we look somewhere else?
Yeah, I would question it. I mean, I don't use disulfiram in my practice, but I've seen tons and tons of patients on disulfiram who are having, flares 7, 8 months in. And I'm like, okay, well, this isn't a wonderful situation. How many bacteria can people have in them that they're still flaring up 7 or 8 months in if it's so good at killing it? It's just, everything has to make sense. If some things don't make sense to me, then it makes me uncomfortable. And it served me well. It's a very common sensey kind of a thing that no one talks about, this fair shake and expiration date. I also think it's equally unwise to take 3 days of a treatment and consider it poison because the flare was too much. So we have to look at the flares, make sure they're not side effects. And if they're not, try to ride them out or lower the dosage or do whatever we can to get through them.
Thank you. And Dana, how many treatments did you bring to their expiration date in
Oh,
your
that is,
journeys? Was there
no
any
one
one
ever
particularly
asked me that.
memorable?
No one
Hmm.
ever asked me that. Great question. Um, well, I would say that I got lucky early on. Well, okay, I got really unlucky for the first dozen doctors. And then when I got introduced to Dr. Phillips, thank God, um, he started treating me right away with, first of all, he worked me up and they found a second tick-borne disease. So we knew I had undertreated Lyme, but then no one had ever thought to check me for any other infections, even though I saw 3 infectious disease doctors and kept asking if ticks could have possibly transmitted anything else. So I think that's kind of crazy when I say it out loud. It's so nuts. So we started with pulsed tetracycline, which pulsing means going off and on for different periods of time. For, in my case, 2 weeks on, 2 weeks off, something in that range. And I got very lucky because it moved me forward. Uh, I had horrific herxes in the beginning, but it moved me forward kind of quickly considering the torturous, endless cycle that is Lyme. Um, and then I had hit walls with a couple of other things that we tried where maybe I got a little better, but nothing extremely earth shattering. And then we tried this other treatment, which was liposomal artemisinin, which I pulsed with tetracycline for short periods of time. And I knew I was done because I stayed plateaued about 60%, 70% for about 4 to 5 months, which felt like an eternity. And I just said to Dr. Phillips, like, is this it? It's okay if it is, just tell me if this is it. And he's like, we don't know yet. We don't know yet. Let's try something else and just see if we can get you better. And we did, and I'm so glad we did. It was a harsh treatment also, but everything is when it works for some of us. So it sounds so ridiculous to the uninitiated that you get so much worse before you get better, but it is the truth.
Well, we now have this public shared experience of people having tough reactions to the COVID vaccine, to some of the
Yeah.
COVID vaccine. So I think that idea is starting to percolate through a little bit,
Yeah.
thankfully, because there's not a whole lot there in the Pfizer vaccine, right? There's just enough to stimulate, but in terms of like a normal vaccine, there's not a whole lot of adjuvants,
Right.
poisons, toxins in there. But still, you have one family member and they're bedridden for 3 days afterwards, and the other
Yeah.
one's out gardening the next day. And so people are starting to get the idea that maybe my immune system is a little bit different than everybody else's.
Right. Great point.
Now, did you make the liposomes yourself for the Artemisia, or is that a commercial preparation?
No, so I actually got it through Hopkinton Pharmacy
Okay.
in Massachusetts. And they just send it. I don't know that, I really liked their brand and I really like them because I get to talk to them sometimes and ask questions. And I didn't have to bother Dr. Phillips as much as I would have wanted because they were there for me to answer, like, is it normal that my head's exploding? Yes, yes, yes. We've heard from 50 patients this week and we hear the same thing. So they're great. And that's the version I took, but I'm sure there's many good ones.
Thank you. Now, Dr. Phillips, we in this community talk a lot about co-infections, and I like your distinction in the book saying they're not really co-infections, but we don't have a precise language yet in the community. Some of the physicians, some of the researchers do, but a toxic stew, not an infectious stew with Lyme and four other, there's no name for a disease. We named the disease. It has one cause, right? One set of symptoms theoretically, and then one cure for it. And that's the classic definition of a disease, if I got that mostly right. But when you start mixing in multiple infections, then is it a syndrome? What are we dealing with?
I think you're dealing with something with, look, the body has a lot of capacity to handle chronic infection. I think it's usually a several hit scenario. I have some patients who've mapped it out where they tell me when they were in high school, they got something that they thought maybe it was mono. They weren't really sure. It never really went away. They got mild chronic fatigue symptoms, but they can function until grad school. And something happened in grad school and just took them out for like 6 months. They had to drop out of school and they clawed their way back. And in their 30s, maybe after a tick bite, maybe after something else. It's like the third hit took them down and they're chronically ill for 4 years. So I know in my own case, Dana has her own situation where we talked about mild situations, relatively mild compared to the last hit that we both had we had all our lives. And just growing up in New England, playing in leaves in the autumn, you have to think who's not getting infected with some version, some iteration of these things. And is it causing really mild symptoms, no symptoms, until something sets the apple cart off, whether it's another infection or it's a big immunologic insult. I don't think it's any surprise that the rates of chronic fatigue syndrome are doubled after pandemic influenza. I don't think it's a surprise that, long COVID is happening. I'm not saying there's not a significant body of literature showing that the virus SARS-CoV-2 persists, but I'm getting patients calling the office that they're sending their records over, and it's pretty clear to me that they have flared up underlying vector-borne illness after COVID. And I'm seeing it in my patients. I have patients who've been away from the practice for years and years, that they were fine, 10 plus years, whatever, calling up saying that in a couple of cases, it was the COVID vaccine that brought them to relapse. And in a couple of cases, it was they just got very ill with an intercurrent illness, be it COVID or something else, and now they're back, and treat them again.
So speculate for me here. Is this immune exhaustion just running out of, say, some cofactors necessary, deep in the enzymatic pathways, even something simple like zinc, or is it conditionally I'm blanking on the word. My own Lyme flares coming up here temporarily. Is like for arginine, it's conditionally essential amino acid, and
Mm-hmm.
do we run out of that? So are we running out of substrate? Or are we running out of bullets, so to speak, on the immune system? Or is the immune system confused? Is it, tilted so far to 2H2 and parasites or open cavities, Th17, something like that, that it just leaves the back door open for, a virus or something like Lyme? What do you think is
I
going
don't
on?
I don't think there's one simple answer. I wish it was like, hey, we're out of arginine, tank up. I think it's more like in the patients where they get flared up after getting another immunologic insult. I think that the infection and the immune system have found a very tenuous truce, you know, and then all of a sudden, when the immune system becomes inflamed, it's like the blanket is ripped off of some hidden organisms. It's like aha, and then the fight starts again, and the truce melts away. This actually just happened to my surviving brother. My brother had CDC positive Lyme test at Quest. It wasn't ordered by me. He had a car accident like 15 years ago, and he had some tingly fingers and went to a neurologist, and she did Lyme test at Quest, and it came back, CDC positive, ELISA and Western blot. And he's never really had symptoms, like a little bit of sleep disturbance, a little bit of heart palpitations, and got a little doxy here and there, and he felt okay. And 3 months ago, he had a tooth pulled, got a low-grade fever after the tooth pulling, and right after that came on with every heart arrhythmia known to man, including SVT over 200, chronic atrial fibrillation, and ventricular tachycardia, which was life-threatening. He was in the hospital for 10 days, had a cardiac ablation, which barely did anything. And it was like too quick to even treat because it happened so fast after the dental extraction. And then I put my foot down when I got discharged, and I was like, I'm forcing Doxy and Bactrim down your throat. And his heart arrhythmias went away within 2 days. So what do you call that? But these are the types of things that I see all the time. And the cardiologists, he has 4 of them, are all saying it's coincidence that his very severe arrhythmias went away with a couple of days of Doxy and Bactrim. And I'm like, I'm not going to argue this point anymore. I've been doing this too long. If you want to speak about it, like logically, I will, but I'm not just going to say it's coincidence because clearly not.
Right. And Dana, I'm going to move over to you since you're in the public sphere. And what we're talking about is really a psychological phenomenon that you could see in any industry, really. There's the old guard, right? They're the way things are done, whether it's the music industry, whether it's medicine, whether it's architecture, whatever it is. What, why are we so stubborn as a species? And how can we get through the thick skulls of some of these doctors to get them to just even listen a little bit?
I love that question too, because I have an answer, which is medical schools need to teach doctors the truth about Lyme and other tick-borne and vector-borne diseases. I mean, that is one thing that's going to be really important right now, as this thing is continuing to explode all over the globe. But in terms of getting doctors to listen, the thing that I learned through this journey, one of the things was that doctors only really know what they're taught in medical school for the most part and do not express a lot of curiosity, especially when you're talking about something as controversial as the most common infectious disease, probably, are the most prevalent and one of the most in the world. So it's been just totally bizarre to me to say, like, I have this infection and have people not believe it. I just strongly encourage patients to bring studies, literature, stories, blogs, stories like mine, stories like Dr. Phillips. I mean, and if you can't convince them that it's real, you have to move on. But I don't know, I just think that doctors are sheep in a lot of cases, and that's just the unfortunate truth. They follow the herd. And if you can get one to listen to you, you're lucky. And then there are some that are really open-minded and that really want to learn and that are educable. But I have not found that that is the majority.
Dr. Phillips?
Yeah, I think that this issue is a human rights issue as much as a scientific issue. It's very difficult to reconcile how you can find this bacterial Lyme, for example, alive in patients after up to 2 years of antibiotics, and that's been published. And then for people to have the nerve to say there's no such thing as chronic Lyme. And I also think that Bartonella, when it's bad, is actually worse than Lyme in many cases. Like, many people come to me with the diagnosis of Lyme. And really, Bartonella is their big one. Bartonella is a lot harder to treat than Lyme. It's inherently resistant to antibiotics, which Lyme is persistent, and there's a huge difference. So Lyme you can usually get under control more easily than Bartonella. It just is very stubborn. It keeps coming back and back and back, and it's that's why something like pulse therapy is really well suited to getting rid of these forms of them that are squeaking out and growing back out. But my case of I edited my story down 4 times for the book just for brevity. It was a year and a half of antibiotics, 9 months of IV. All of it failed. A rheumatologist was like, "What are you doing to yourself?" I was like, "Every antibiotic flares me up." She's like, "I know. Stop." She's like, "Just take an immune suppressant. It'll make you feel better." I'm like, "No, it doesn't make sense. It doesn't make sense to me that all these antibiotics are flaring up every symptom I have. There's an underlying infection. It's like a Herxheimer, but I can't get through the other side." And yeah, she said, "Steve, that's called not working." So it was a very different kind of overly simplistic way of looking at the same problem. How do you get through to people? I don't know. I could tell you that after I got better, I went back to my 3 rheumatologists and I said, "Look at me, I'm great. My rheumatoid nodules went away. My knees that were the size of cantaloupes are now normal size, and I can do everything. And my blood counts normalized, and my fevers went away, and I gained back 50 pounds, and all these things." They couldn't deny it. It was impossible to deny. One rheumatologist was overjoyed. She was like, "Congratulations, you did it. This is so wonderful. I'm so happy for you." The other one was like, "Well, I can't deny your exam." The other one looked at me like I was a crazy person, but like just a different species. And none of them would change how they would approach patients. I said, "Will any of this impact on your approach to patients?" They're like, "No, no way. We can't go against what we were trained." I'm like, "Why not? If science doesn't advance with new information and innovative thinking, why do they call it science? Call it something else. Call it dogma. Call it stupidity. I mean, what are they going to? Shouldn't be called science, you know."
So is medicine science then?
I don't know that the practice of medicine is science. I think the practice of medicine is, at this stage of the game, is really focused on expediency, and doctors have been reduced to kind of clerks, in many ways, and following guidelines that are written by people that barely see any cases of the illness for which they're writing the guideline. It's a very upside down, bizarro world, and it's very dystopian, actually.
You see the same phenomenon in education where I call it the McDonaldization of education, the McDonaldization of medicine. They, the cash registers, if you ever look behind the cash register, it's pictures. They're not even words, right? It's designed
Yeah.
for the least common practitioner, the least common patient. And if you fall outside the little box, you could be in a world of hurt without people like you, without physicians like you, without other practitioners, at least willing to listen and guide you in the right direction. I mean, that's when I see Lyme in my acupuncture practice, that's essentially my job is to forward them to somebody who at least will listen to them and to reassure the patient, you're not crazy. You have a disease. Get tested. No, that's not the right test. Go back and get the right kind of test. And speaking of the right kind of test, I want to tell a very, very short story and then ask a question about testing and diagnosis where we are right now, because I think your approach is a little bit different than what we normally see. So about 7 years ago, I had a patient come in. He was a hotshot pediatric orthopedic, and he had to retire. He was at the top of his game, had moved into the area, recruited in, big fanfare. They're gonna, do all kinds of stuff for him in the surgery suite to take care of him. He loved difficult cases. He embraced those. He didn't want the simple things. He said, "Give me the tough cases." Lyme took him out. And it was the same story you're telling. It was probably his second or third infection because he had had some earlier symptoms. And finally, the fatigue and neck pain, he couldn't operate anymore. He was done. So here's a person with a lot of credibility, a lot of street cred in the orthopedic world. He brings a colleague to dinner. We have dinner and we're talking about Lyme, and he's telling a story and he's telling him all about Lyme disease. And this orthopedic head of a local clinic, a big local clinic, and he's saying, a lot of the arthritis that you're probably seeing might be Lyme disease, right? It's something you should be testing for. So this orthopedic was open-minded. He's asking questions, and at the end of the dinner, he says, "Look, I don't know what to tell you, but basically, as you're telling me, you don't have a test that works. You don't have a treatment that works, and you're asking me to do something, and I have no idea what it is that I'm supposed to do.
Right.
So why is this, why has this changed? How has this changed now? How could we be talking to that orthopedic a little bit differently?
Okay. No, it's a good question. It's daunting because the education is not there in med school. It's hard to say, hey, what I practice, we learned nothing about in med school. There's one paragraph about Lyme. The paragraph was wrong. I had two doctors shadow me for a few months trying to learn what I do, and both of them were like, "We love you guys, your practice. Everyone here is amazing. This topic, this vast, daunting elephant in the room is too much, and there's no way I could possibly do this." And it wasn't anything to be like, "Oh, it's too controversial for me." It wasn't even like that. There was no basis. There was no groundwork. There was no nothing for them, and they were general practitioners in the community that, in Connecticut, there's a lot of Lyme. So they figured they really were interested, genuinely interested. They referred tons and tons of patients to both of them, but they couldn't do it. So what do I say to people who are learning? I think we have to start to get education at the medical school level. I think that when people's minds are younger, they learn better, and that's the time. It's just that I've been learning through my patients and through my personal experiences and through my family's personal experiences since 1996. And it wasn't like it was someone tried to teach me in 6 months. It's been over several decades now, so it wasn't so daunting for me. But for people who are trying to train, it's really, really hard. And there is no formal right or wrong way. All the doctors that do what I do things differently. And you can just look at someone's notes and see which doctor they went to by how they were treated. I don't even have to look at the signature on the bottom of the page. I know the doctor is. So
Now, and this is a question for both of you, and we're talking about pandemics, right? We have one pandemic that everybody knows about. On the cover of your book, you talk about autoimmune pandemic, which I'd never really thought about, but it's true. We've got this invisible pandemic called Lyme disease. The numbers all there. I don't know why it's invisible. It's as plain as day, but it's not recognized. It's not talked about as a pandemic except in our community. Is is this because the world's more toxic? Is it because the world's warmer? Is it because we eat a credit card worth of microplastics every week that we can't avoid? What's going on here?
you're the third person to ask me this wonderful question. I think it's the best question out there. Close to your question, Dana, about the expiration date.
Yeah.
Yes. So these infections have been with us as a global community forever.
For a long time.
Why now? Why have chronic and autoimmune illnesses skyrocketed? It's been like a slowly exploding bomb as opposed to COVID, which is obviously a rapidly exploding one. And that's why it did creep up on everybody. But if you look back at the rates of chronic illness over the last, it's chilling. Even if you look at sperm counts going down over the last 20 years, it's chilling. We're clearly being exposed to toxins in the water we drink and the air we breathe and the overly processed garbagey food we eat. Just take a trip to Italy if you want to know how crappy food is in the United States. Food in a food truck in Italy is 10 times better than any gourmet restaurant you can go to in basically around here. I just think that we are being slowly poisoned, and it comes down to legislation of what toxin is. When I read just recently that they approved this pesticide for the citrus industry that's like banned all over the world, and they just gave it the stamp of approval for the United States. I just switched to organic orange juice. I mean, and I've been slowly switching for everything. And you have to wonder about the stuff they spray the lawn with the, these various pesticides. So I don't know where, I don't know. I don't think it's a simple one or the other, but I do think it's a cumulative exposure to a lot of garbage.
I would like to comment on that actually, because I am a New Yorker who was totally, freaked out by the pandemic last March. And I drove across the country, and I'm living in California now. And I live in a beautiful community on the coast of San Diego. And I finally found a house that I loved. And behind my bedroom, there's a hill that is considered common space, even though nobody can access it. What I did not know is that that hill would be sprayed with a very toxic chemical called diquat. It is banned in the EU. And my dog got, who was perfectly healthy, got immediate seizures. Um, what I was telling Steve, Dr. Phillips, was like a motor neuron looking disease. I said she looked like a robot. I sent him a video of her the next morning after she got this hit and inhaled this pesticide, lying on the floor, not responding to her name over and over and over. And I was getting also, I didn't connect the two, this violent nausea and these low grade fevers. And I was calling him all the time, like, I think I'm dying. I don't know, what could this be? It was this chemical. And I consulted all these toxicologists about it. And my dog's specific symptoms, which started with her paws burning and then resulted in seizures and Alzheimer's like confusion and just sudden onset. I said to Steve, "Oh my God, we have another book." Because what I have seen,
Yeah.
just what you want to do, right? Steve, write another book.
Well,
But
we were talking about these along these lines even before Lucy got sick, and Lucy's Dana's dog, and then it brought it really into sharp focus. This is happening, you know. Lucy's like a canary in the coal mine. She's a very sensitive dog. What about the dogs that are less sensitive? What about the people that are less sensitive? What happens when they're exposed for 30 years to this stuff? You know, this is just one of many. I do think it's there are many crimes going on against
yeah,
humans, whether we know about them or not.
yeah, it's a
It's the
nightmare,
curse.
honestly.
Yeah, it is. It's the curse of technology. And ever since fire, there's always the back end of it. And it takes years or decades or centuries to figure out the damage we've done. And then you have to rely on technology to clean that up, which causes more problems.
I
And
yeah.
it's one of those conundrums. Like, can we ever turn that ship around, or are we just destined to have to hop to another planet and try and start again? Really, it's a tough one. It's brutal.
It's unavoidable.
I, I think it's risk mitigation, and that's one of the points in the book is that there's no safe time to have. How long can we have a tick attached when it's safe? You know, for less than 48 hours, right?
There's-
It's exposure, right? It's all about exposure and risk and the percentages. So, and then the terrain. How sensitive are you? And in some ways, I wonder, you know, are those the canaries in the coal mine, or are those people who are struggling, whose genetics aren't adapted to a toxic world? Are we thinning out the herd? You know, and I mean this in a compassionate way, not a mean way, but are the people who are really struggling to detox, their pathways aren't as robust. You know, they did PON1 genes, the glucuronidation, the acetylation pathways. Are they not able to remove these toxins as well? Or do they just have the wrong mix in the microbiome and they can't degrade things as well? We don't even know what we don't know on this topic. And then to throw in these chronic infections to bring it back to Lyme plus, and I want to is amazing. So let's start at the bottom, because you give a list of symptoms, comprehensive list of symptoms that's just beautiful and dizzying at the same time. You know, you talk about, oh, we want to find the upstream, the cause of it. At the bottom, downstream, these are common symptoms that you can attach to so many syndromes, so many diseases. How do we swim upstream and find the cause? Because you also give a lot of infectious causes as well, the upstream causes of this. When after we've gone after the usual suspects, Lyme disease, Bartonella, Babesia, and we've hit a plateau with treatment, either we're not getting better at all, or we've had partial recovery and that's not happening. How do you triage and choose what to go after? Because simply testing for everything at this point, most people can't afford that. How do we do that?
I mean, I did most of the tests in network labs. I don't do that many send outs, but I think it's a matter of checking off the boxes of therapies that do work. Like I always use an example of a patient who pretty clearly had Bartonella, came to see my nurse practitioners a few years ago already. And right after the first visit, he called me. He said, "Can I speak to Dr. Phillips?" I spoke to him. He was crying on the phone. I said, why are you so upset? Was the visit that bad? And he's like, no, she's amazing. But she told me to go off doxyrifampin. I was like, well, how long have you been on doxyrifampin? He said, 6 months. I said, is it helping? He said, no. I said, then why are you crying? She's telling you to go off a medicine that's not helping. He said, because I talked to my other Lyme doctor and she said that the only treatment for Bartonella is doxy and rifampin. It's like the best treatment. And it was a very kind of stereotypical kind of a thing. So rifampin helped me a great deal, and it helps a lot of people. And when I came back to practice, I was like, oh, my case was so tough to treat. The stuff that helps me is going to help other people. It really doesn't work that way. I mean, they did a study in 2016 where they extrapolated out with this very reliable math equation based on the genetic variability of microbes that we know about, that we've only discovered 0.001% of the microbial life on the planet. So for us to think, well, we can't pick it up on the test. I mean, first of all, 1 milliliter of blood doesn't represent what's going on in the whole body. And number two, there's all these microbes that we don't even have a clue about yet. So I'm not tied to the tests really. And if someone's not getting better with X, I have a relatively low threshold to try Y, as long as Y is in my subset of medications that I feel comfortable with that don't have, significant, neurotoxicity or bone marrow, any of these, some of these newer treatments I'm a little scared of, so we don't use them in the practice, but I use a lot of stuff. And thankfully, by going through a lot of stuff, we can get most people better.
So do you ever find something like mycotoxin that you thought, oh, in addition to the infections where you just, we've done the entire list, you've gone through your entire palette of antibiotic type treatments, and it's like, we're still not there. What else could there be? So what other things like that do you have in your wheelhouse? Do you say, okay, we're past the infectious state, but we're still not better. There's something else in the background, well, in the foreground.
I don't know necessarily. I don't think they're mutually exclusive, like past the infectious stage, because for mycotoxins, they induce Th2 in a similar way that parasitic infections do. So they can just make it really hard to get over that infectious stage. I have lots and lots of patients who have said the same story where they're fine for years. They get a job in a moldy building in New York City, like one of these from the 1800s or something, and get a recurrence of their illness. And is it a mycotoxin primary situation, or did they become immune suppressed from exposure to mycotoxins and their Lyme Plus came back? I think it's more the latter. I'm not saying mold is good. It's terrible. I've had mold exposures and developed a lot of weird things from them, and they're crappy, and I highly recommend avoiding them. But I also want people to be careful about the mold abatement industry, because it's very kind of not so clean sometimes. And I've seen people get ripped off when they can get a legitimate contractor do things at 1/4 the price. So some fine balance between that is really reasonable. And I'm very, interested in checking for a wide array of parasitic infections. When we wrote the book, I was not checking for parasitic infections routinely. In med school, we're taught that the parasitic infections in the US are so boring, don't even check for them, right? So, and maybe they don't make us sick frequently in and of ourselves if we have normal immune systems. But number one, people with Lyme Plus don't have normal immune systems. And number two, how do the parasitic infections and chronic bacterial infections interact? And there is data that they interact in a negative way, where parasitic infections will make bacterial ones harder to get over. So I started checking just at chain labs, at Quest and LabCorp and everywhere else, panels of common parasitic infections like Toxocara and Toxoplasmosis and Strongyloides, and I've even found cysticercosis and Echinococcus, like ones you wouldn't think would even be in the US, but it's a small world, everybody travels. And I would say 1 out of 5 of my patients, just at local labs, test positive to a parasitic infection. My dad tests positive for 2, filaria and Toxocara. It's crazy.
And then what about parasites that migrate to like the liver and the brain? I'm not familiar with testing for those. What do you do there?
Well, these are the ones I was talking about. The ones that I just mentioned are all like invasive ones. And then there are the GI parasites that are less invasive, like Giardia. And I mean, amoebiasis can be invasive, but it's generally, defined, confined to the GI tract.
And so the stool test will reveal those as well, even if they
Not always, because like some of them are just, a lot of them don't complete their life cycle. Like Toxocara is always a baby worm situation. So when Toxicara is spread by dogs and cats, when you're 8 years old and cleaning up after your dog, do you really wash your hand like a surgeon before you have a French fry? Probably not. And then eat some Toxicara eggs. They hatch. They turn into baby Toxicara worms, which are microscopic. They never reach maturity in a human. We're a dead end host. So because they don't turn into an adult worm, they don't lay eggs. They don't go to the GI tract. They just swim around as babies. And the disease state is directly proportionate to how many eggs you ingest. How many eggs you ingest over time. If you had a heavily infected dog or cat and didn't deworm your pet, you can get a bad case of Toxicara. And in some cases, Toxicara has been associated with things like dementing type illness and psychiatric illness. And certainly toxoplasmosis has been associated with psychiatric illness. So these are, real concerns. And I always said my dad's condition was, dilated cardiomyopathy. We've had about 50 patients with this condition. We've got every one of them, thankfully, better. They were all facing just going down the slope to heart transplant, like Neil Spector did. And we got them all better, except one was so hard to treat. And he kept going down and down and down on all the antibiotics. And he tested positive for toxoplasmosis. And we adjusted into like an anti-parasitic kind of a target instead of just the antibiotic stuff, and finally got him better. And that's, I think, and there are cases of toxoplasmosis causing dilated cardiomyopathy, believe it or not. So
Now, that's an inspiring story of stick-to-itiveness, right?
Yes.
Not giving up. How long did that process last for that one particular patient? Is that over a year? Is it
yeah,
months?
that
What are
one
we
particular
dealing
patient had a
with?
scary case because we were all stumped. We were like, why is he getting better? We've never had a patient with I mean, not to say that dilated cardiomyopathy, it's hard to say fast, dilated cardiomyopathy is easy to treat for someone who's like novice at it, because you can get these cardiac Herxheimer's that can kill people. And the first person I treated was my dad, and I treat him way too aggressively, way too fast. With these type of end stage cardiomyopathies, you have to treat really slowly and just slowly peel the layers so they get small cardiac Herxheimer's and get better to do slow than fast. And but the guy just kept getting worse and worse over about a year. And we're like, what are we doing? We have no idea we're so confused. And I was like checking for every parasite known to man, and Toxo came back, and we focused on that. And all of a sudden, and his ejection fraction went up. So
And the second, so follow-up question, and how quickly did things turn around once you got the right
6
treatment
weeks.
in there?
6 weeks.
I think that's important for people to hear, like the time frames,
Yeah.
because you'll hear that we'll make up stuff like, "Oh, I'm supposed to get that better in 3 days," or "Oh, I'll get better in 6 months," and like, what is that window?
I've
And
heard patients come in and tell me that their doctors are telling them it's normal to take 3 years to start to improve. And patients that have come in on years of antibiotics that are failing and saying their doctors are. I just want to tell your viewers, run fast. If someone's telling you it's okay to feel poorly for 3 years and not improve, listen. There are cases that I don't get better in my practice, and nobody, the stubborn cases. But it's not a situation where those stubborn cases all of a sudden turn around after 3 years of the same medicine. So
now you also talked about, Dana, I'm going to swing this over to you. You talked about some of the psychological ramifications of having an infection and the different types of infections, whether it's viral. We all know about PANS and PANDAS. Whether it's bacterial, we know what happens with Lyme and Bartonella. You're talking about parasites can affect the mind as well. So, Dana, will you tell us a little bit about your experience? Like, you're a creative person. You rely on your mind for your bread and butter. How did Lyme Plus affect you, and how did you deal with those changes?
I really thought that I was going to die. And I thought if I didn't just naturally die from the Lyme slowly killing me, which it really, or quickly in my case, I mean, I really, we talk in the book about like this slow boiling frog or the runaway train. I feel that I was more of a runaway train because my symptoms just came in this quick, horrible succession where I felt like I'm on this roller coaster and I'm trying to hold on and it just keeps going and going, going. And when will it stop? I was afraid to wake up every morning. And what's so fascinating is we have Dr. Bransfield here. So this is a crazy story that I don't really tell too often, but since he's here, I want him to know the impact of his presentation. I had severe overnight anxiety, crippling depression, insomnia, and psychosis. So every time I tried to fall asleep, I saw this crazy loop of melting monstrous faces. I thought that when I saw Dr. Phillips, that if I told him that, he was not going to treat me because he would just relegate me to being a crazy person that he didn't want anything to do with. So I didn't tell him that symptom in my first appointment. As I began to treat with him, that symptom very quickly went away. And I should also mention, I had no psychiatric history. I'm one of the few people that I know, especially in the music business, who's never taken an antidepressant. I'm pretty steady. If my parents are watching, no offense to my mom, but I thankfully have my dad's steady, even nature. I think Steve won't argue with me here. So I knew that there was something in my brain. Like I never thought that I was crazy in the sense that people are sort of told and the way that people feel. So people should know, like, these infections create inflammation in your brain that cause these symptoms. You can totally flatten out. I am like an energetic, vibrant person, and I became like a robot. I could barely talk. I could have no expression in my voice. I couldn't even conjure it. It was like a light switch. So it was terrifying, and I had terrifying intrusive thoughts of killing myself constantly, of jumping out of my window. I lived in a high rise, and I didn't want to kill myself. So it's this weird thing where I don't really want it, but I can't stop thinking it, but I want to stop thinking it. And I saw Dr. Bransfield do this presentation when I first got into kind of the community of the Lyme world. I got to go to my first ILADS conference, and I saw him present. And one of the things that was so fascinating was he had a slide. I have a screenshot of it, Bob. So thank you for doing this, because it truly brought it all home for me. Of all these, the common hallucination is like melting monstrous faces. And I was blown away. And so in my second or third appointment with Steve, I said, well, because he goes over, what's better, what's worse, what's the same. Well, I said, I was sheepish. I said, well, one of the things that went away, I didn't tell you. I was kind of embarrassed and nervous, but I had this crazy, before I went to sleep, I was seeing this loop of, and he was like melting monstrous faces. I said, what? How do you know? He's like, I hear it all the time. I didn't know it was a thing. So it's a thing. And why does that happen, Bob? It's crazy.
It's a temporal lobe symptom, and it's like an intrusive symptom.
Yeah.
And people are very reluctant to talk about it because it's so bizarre.
Yeah.
But it's intrusive symptoms. It can be intrusive images.
Mhm.
It can be intrusive emotions. It can be intrusive thoughts.
Mhm.
And they're what we would call egodystonic. It's not something you would voluntarily generate. And intrude is a good word. It's like someone who breaks into your house.
Yes.
As one of my patients said, I put on a slide, it invades the privacy of my mind.
Yes.
And
love
it's like being flicking from one cheap horror movie to the next on your TV set. Chainsaw Massacre and the dead, boom, 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 boom. And it's like, where does that come from? And it's similar to what you see with post-traumatic stress, because there you see intrusive symptoms. And then a lot of Lyme patients have trauma and post-traumatic stress from having Lyme, but also the physiology of Lyme makes you more susceptible to having a post-traumatic stress reaction from the trauma that you get from Lyme or from any other trauma. So and I did write an article about it, and it's the only article that I think was ever done on it. And but it's something that is so bizarre that it is very hard for people to talk about, but it's very common. And it does improve from treatment. It doesn't mean that that's you. And they can be violent, sexual, horrific, bizarre. It could be anything.
Yep. It was very, very helpful for me to hear you talk about that early on in my illness, because I really did feel very ashamed of it, and I didn't understand it. And I had never experienced anything like losing control of my mind completely. And I didn't know how common it was until I saw you speak about it.
It's not exactly psychosis. It's not. but
It's not psychosis then.
it's different. It's because
Yeah.
there's an awareness. And whenever I give a talk like to a support group or the public, for example, and I talk about that, I see a lot of heads nod in the audience,
Hmm.
and that they feel, they can relate to it.
Hmm.
So
Interesting.
You guys mentioned two very important things. Danny, you mentioned shame, and Bobby mentioned PTSD. I mean, there's so much shame with chronic illness. I completely hermited from friends. I wouldn't let them see me. I looked like a parchment tracing on my former self. So I was just embarrassed about how bad I looked. And it was just shame everywhere, and they say the antidote to shame is tell your story. So I figured go big or go home, right? Tell your story big time. But the other thing is that the PTSD, there are such durable, quick, good therapies for PTSD now. We have a whole section on EMDR in the book. Dana's been a big fan. I'm a huge fan. My brother died in July. People find it hard to believe that I didn't develop anxiety or depression with my illness for whatever reason. I don't know why. I developed everything else. I should have gotten that too, but I didn't. But I developed hardcore anxiety when my brother died. And the only thing to help was this EMDR. I did 3 sessions, and seriously, by the end of the 3rd session, I was good. And now I'm just a neurotic New Yorker again. But before that, I was crawling at the walls. I couldn't take it. How I was a nonstop fear of imminent demise. So PTSD is a very real and common phenomena, and we all go through stresses in our life, and chronic illness is one of the big stresses that many of us will face.
You bring up the push and pull, the embarrassment of speaking up, and then also depending on the listening of the physician on the other side, and whether they receive it or not. And some of the hesitancy is brought about by real experiences of being beaten down or chased out of the office or laughed at or referred to, no offense, Dr. Bransfield, but to a psychiatrist when there's a physiological underlying reason and they just know there is. Like you said, it's an intrusive thoughts that they're having, not a psychosis, not a psychosis. Do you have time for a handful of questions?
Sure.
Yeah.
Can you give us a couple more minutes? So number one, Dana, this is for you because you moved to the left coast
Yeah.
and sand and beaches and the Bay Area Lime Foundation is like, it's something everybody on this presentation knows. And now we have evidence. It's like their beaches are full of ticks.
Did you know that I was bitten at a beach?
No.
I actually was. I left Manhattan for a 4th of July weekend in 2014 to go to my dear friend's wedding. And it was on Long Beach Island, New Jersey. And I didn't do anything other than they rented these 2 big houses on the beach, literally like plopped in the sand. And all I did was, drop my stuff off in the house, go down to the beach for an hour, sit on a chair, no grass, nothing inside. I saw no deer, the kind of things that you think of traditionally with Lyme. Went to sleep, came home, changed the course of my life being there for 24 hours. It was that was where I got bitten. And I had the bite right here on my shoulder, and I'm in the lucky minority that saw the bite and the rash. So, but it's funny because that study is to me, that study is really important. It's a really big deal. The Bay Area Lyme did this because people let their guard down. We all think of Lyme as being the hiker's problem, the people who camp. That's absolutely not true. Hikers and campers are very well aware of Lyme. They're the ones who are covered in permethrin and tick checks and showers, and they know. It's people like me, unassuming new Manhattanites, going to a wedding for 24 hours on a beach. They aren't looking for ticks.
Is there any place on the planet at this point where you're not in danger from Lyme or another Lyme plus?
Antarctica, and maybe Hawaii, although that's arguable.
Yeah, I don't think there's any place you're not in danger of Lyme plus.
Lyme plus. Sorry,
yeah.
I didn't hear the plus.
Yeah, the pluses are everywhere.
Yeah.
You can't get away from the pluses,
You're right.
unfortunately.
Absolutely.
I think they found Lyme in Antarctica.
They found it off in penguins off an island
Yeah.
off the coast of Antarctica.
Okay,
Don't-
well, I quit. I quit life now because we
Ma-
can't even move to Antarctica anymore.
Don't pet the penguins.
Yeah.
we have a question that it's very timely, and it has to do with people who are infected, have the chronic Lyme Plus, receiving vaccine. And I know you can't give medical advice, but can you talk around the topic a little bit?
I guess the way I've seen, I have seen rare cases of patients where they have a long history of chronic illness and is undiagnosed. And as part of their history, they come and they say they got a vaccine and their illness exploded after the vaccine. I have not seen, while this is pre-COVID era, I have not seen patients really, when I say explode, I'm talking about very, very bizarre things like young women losing their period, and being now post-menopausal at age, 22, something crazy, and developing type 1 diabetes all of a sudden, and just weird stuff. But I've not seen any of that in patients who are actively treated. So I have to wonder when, again, it's like my brother with the dental chair, and getting the tooth pulled. When you get immune stimulation and have these bacteria kind of, I wouldn't say dormant, because these cases they weren't dormant. They had chronic symptoms. They went to doctors. They didn't get a diagnosis. Boom, got a vaccine. And so it may not be inherent to, a poison in a particular vaccine or anything like that. It could have happened if they got influenza. It could have happened with other immune stimulation potentially too. But I have seen those cases. So I wouldn't want to sugarcoat things and say, oh no, everything's been fine, because we've all seen stuff. And I've seen so many cases of weird illness that, of course, I have seen stuff. The COVID vaccine, it's been all over the place. There have been a lot of patients, even with really, really severe illness that have, in my practice, that have had the vaccines that they've been fine. And I've had some patients get the high fevers and the 3 days in bed, like you had mentioned before. And I've seen some patients, like I mentioned before, who had relapses. They were away from the practice for a long time. And I've seen some ER visits from the vaccine. So I have seen higher rates of weirdness with the COVID vaccine that I've seen with like flu vaccines and even meningococcal vaccines and whatever. So it hasn't been the same as a routine vaccine from my experience, as much as people say it is, but I don't think it is. But it's very important for us to be protected in some way. And I think that they should strive to getting safer and safer vaccines.
Thank you. And the last question is a political one. And given your experience, and I know that Dr. Phillips, you've also done some testifying at the federal level, is there some legal approach with a class action lawsuit, just maybe with the end goal in mind of changing things, but maybe even just to support the Lyme patients who feel unsupported and unheard? Do you see any use in that?
I mean, I'm not a special, I don't, my knowledge base in legal stuff is really, really limited, but for whatever angle that these injustices can be pursued, I would encourage people to pursue them, because they're not going to change unless the change is forced. There is an inequity that's going on. They talk about equity of health care and everything else. This is such an inequitable situation. And sometimes we feel like we're such a small group who are screaming from the rooftops that people are dying, people are becoming disabled. This doesn't have to happen. I mean, I saw how it was to be literally an 85-year-old man in a nursing home who can't go to the bathroom by himself. So to go from not being able to sit up on my own, not being able to turn over in bed on my own, and not walking for 2 years and almost dying so many times, to going to have this full life again, I was like, wait a second. How come everybody doesn't know this? How come this isn't being taught in med school? It gets me really, I'm a pretty mellow person. I don't really have a big temper, but it's really enraging. It's very frustrating. And the patients that are going through this, they must feel powerless on many occasions. And how do you get power back? How do you grab back the authority to take your own healthcare into your own hands? It's by banding together and making legal inquiries, because just to ask the medical authorities, hey, can you take our condition seriously? They've tried that for 30 years. It's gone nowhere. It's like the status quo doesn't change because they're happy with the status quo. And I can tell you that medicine is, there's a lot of financial motivations that lead medical research. And that's just the bottom line. And we all know it. And no one really talks about it in certain circles, but it's happening, and it happens all the time. So.
Dr. Bransfield, do you have any comments in that area?
Yeah, I think your problem is, and you see the same with COVID, you have the backroom bureaucrats calling the shots instead of the frontline doctors who treat it every single day. For instance, there was a testimony on COVID, and there was a doctor, an ICU doctor, dealing with these patients all day long, testifying about treatments that were effective. And then they had another doctor from the IDSA who said, "Well, these are dangerous treatments; they don't work." And then he said, well, "Doctor, how many COVID patients have you treated?" He said, "None." And he was the expert. And we see that with the CDC, the NIH. How many COVID patients does Dr. Fauci treat every day? And so, and with Lyme disease, how many these people in the CDC that write the guidelines or that give out the research grants, how many patients do they have the long-term responsibility to care for? They don't. So that's the problem. It's like this backwards type of system. And I think that needs to be changed. Hopefully COVID would shed light on that would spill over to Lyme. I hope that would happen. This may draw more attention to the long-term consequences of chronic infectious diseases
That's true.
and how they cause chronic illnesses. And even that, they come up with these absurd words like long haulers and chronic. Chronic is the word. Use the right word. It's chronic. It's more than 3 months. Be accurate. And why are they dancing around it? Call it what it is.
It's almost like it needs a big orange book with chronic just across the front of it, you know, almost.
It's a great idea. Somebody should write that.
Yeah. Why don't you write? Yeah, that's a good idea.
Well,
Okay?
only if you'll be interviewed. Only if you'll say yes.
Yeah.
So, Dana, I'm going to give you the last word. And also, will you wrap up by telling people where they can get the book and your website and anything else you want to plug to wrap this interview up?
Sure. Well, I'm happy to announce today that Dr. Phillips and I will be appearing on The Doctors on May 13th. So you're the first to know. We just found out
That's
today
exciting.
when this was going to be airing. So we're excited about that. And I want to also just thank people so much for supporting our book. We just found out we're back on the bestseller list today and yesterday. And we just incredibly, this book is totally from the heart. We always say it was a labor of love. We're not just saying that. It's not something to say. We worked on it for 2.5, 3 years, and we put everything we had into it, and we thought about all of the patients that are watching this and all the people that we hear from and all the parents that we hear from with kids who are suffering. And you're always close and near and dear to our hearts. So in terms of where you can find the book, you can get it on Amazon, Barnes and Noble, Books A Million, anywhere books are sold, Target, Walmart. We hope that that if you buy it, you will share it with your doctors and you share it with friends and family, because there are 50 million Americans suffering before COVID with chronic and autoimmune illness, and they have no answers. They are stuck on the medical merry-go-round for years and years and years, and sometimes forever. I never had to go on immune suppressants or psychiatric drugs. And I just want to say, when the underlying cause of my symptoms, which ranged from fibromyalgia to heart failure and many things in between, were treated, and all my psych stuff, with antimicrobials and antibiotics and some Chinese herbs, all of my symptoms went away. Okay, so this is the takeaway that I hope that you will hear. Get to the root cause, demand answers. If something doesn't feel right, move on, trust yourself, because you are your own best advocate. You know your body, you have intuition. The only times I made mistakes was when I didn't follow my gut. So that's, to me, that was the biggest lesson, is just I had to rely on myself, because this is the Wild West. So if you want to come in and visit with Dr. Phillips and me, we would love to hear from you. Our Facebook page is at facebook.com/thechronicbook. Our Twitter is at LymeBook. Our Instagram is The Chronic Book. And then our personal Twitters are, for me, at Dana Parrish. And for Dr. Phillips, it's Steve Phillips, MD, at Steve Phillips, MD. There's no N, no Steven on this one.
Couldn't fit it.
Yeah, we couldn't.
But you know.
Yeah. And the chronic book at the, our
Right,
website.
of course.
Chronic-
thechronicbook.com. Just
Yeah.
little details like that. Yeah. that
Yeah,
website too.
absolutely. Absolutely. And if you need help, if you need to find a doctor, Bay Area Lyme is a great source of
Yes.
a great resource. iLads is a great resource. Lyme Disease Challenge, LymeDisease.org. We love, I mean, there's too many to name. Southern Tier, Limelight, Live Lyme. We love all of them and we support everybody.
Thank you so much for your time, the love you put into this book, sharing it, having the courage to get out there and spread this word and tell your stories. It's not easy to open yourself up to professional ridicule, in your case, Dr. Phillips, and maybe just social ridicule, Dana, and people just tell you, you don't know what you're talking about. You just have
Yeah.
no idea. And to be able to stand there and stay centered and say, yes, I do. This is real. My experience is real. I actually know what I'm doing. I can turn patients around. And you're the one who doesn't know what you're talking about.
Right.
So
It's my
thank
greatest
you.
pleasure.
Yeah. Thank you for doing that. And thank you for the Southern Tier Lyme support for sponsoring this. And we'll be back next week with Dr. Bransfield to continue this amazing conversation and really focus on the psychiatric and the brain neuroinflammation angle to Lyme disease and Lyme Plus. I love Lyme Plus. So thank you all very much. Have a great evening. Thanks for
Thank
joining
you.
us.
Thank you
Pleasure.
so much.
Good night.
Thank you, everyone.